All right, I think we're going to go ahead and get started. I want to thank everyone for joining us today. We've got a great speaker joining us today, going to have a good conversation around Medicare. This is a topic that we get a lot of questions about, and we are informed on the topic, but I think much like anything, when you start to delve into it a little bit more, it's always great to bring in a specialist who spends his days or her days dealing with this specific topic. And I've had the pleasure of knowing our guest for about 20 years, Richard McQuerry. Richard, for the last 17 years, has been involved in the Medicare space. He's the founder of SilverBridge Insurance Solutions, and really solely focused on Medicare planning. And one of the reasons that I really like working with Richard and introducing Richard to our clients is he is a big advocate of education, because there are a lot of decisions that have to be made around Medicare, not just initially and when you sign up, but also ongoing. And so having someone like Richard working with our clients who can help them make decisions as the system evolves is critical. So with that, Richard, I'm going to hand it over to you and let you get started on your presentation.
Appreciate it, John. Thank you for having me. I always like to get in front of new people and talk about Medicare. Like you said, I've been doing this 17 years, and for whatever reason, Lord bless me with being a Medicare nerd. I enjoy diving into these details and really trying to find the nooks and crannies of where planning can really make a difference in people's lives. So I appreciate you guys having me. As John said, I've founded SilverBridge Insurance Solutions, located here in Lexington, Kentucky, native born, licensed in 7 states. And we're going to just spend a little bit of time. I've got a little agenda here for us. We're going to hit the Medicare basics today. I like to just start at the start. We're going to talk about what Medicare is, what it's not, define a few terms, and then jump into Medicare supplement, Part D prescription coverage, Medicare Advantage, something called IRMAA, and then some new rules that are kind of affecting on a national and on a state level that are impacting Medicare decisions for people. So with no further ado, we'll talk about Medicare. Medicare is federal government insurance. It's broken down into 2 parts. Hospital is Part A, and medical, which is everything not room and board hospital. So that's doctor visits to emergency room to MRI, lab work, outpatient surgery, physical therapy is all Medicare Part B medical. Now, Medicare insurance is provided to anybody 65 and older that paid in or was married to somebody that paid in to Medicare taxes or withholding for 40 quarters, which would be like 10 working years. So if you paid in, you are entitled to Medicare Part A at no cost. Medicare Part B, however, does have a cost. Currently, for 2026, the standard premium for Medicare Part B is $202.90.
Hey, Richard, just for a second, I think your screen may not be showing that slide. I think it may have gone off.
Oh, you're right. Let me get back to the share here.
Yeah,
I'm so sorry.
Oh, no worries.
We had it and we lost it. Got me?
Yeah, that taskbar is showing in front of the presentation, but that Ballast Educational, you maybe just want to show the slides.
Is it, well, shoot. Let me try this again.
There you go. Perfect.
There we go. Sorry about that.
No worries.
Yeah, so Medicare Part A and B. A is provided at no cost. Medicare Part B is, again, $202.90 a month is the standard premium. And for that, you get an 80/20 co-insurance plan from the federal government. Co-insurance is a percentage where, as opposed to co-pay, which is a fixed dollar amount. And 80/20 insurance is good. Now, the medical largely works on the 80/20. For purposes today and in most general conversations, I keep it simple like that. Hospital has a little more nuance to it. There's a per diem based on how long you're in the hospital, but they try to base those amounts on a roughly on an 80/20 amount. So without getting into the weeds too far, I try to just tell people we can just assume it's largely an 80/20 arrangement. So the government's going to pick up 80% of your bill, and that leaves you 20%, which is great. But one thing about Medicare is there is no maximum out of pocket on that 20%. So as high as your bills get, the 20% continues to grow. There's no limit like there probably is with your group insurance or other health insurance that you've had. That part is kind of basic. I think a lot of people are pretty familiar with that, but a couple of other costs that sometimes trip people up. Medicare has deductibles. The Medicare Part A deductible is a little over $1,700. Medicare Part B currently $283. A deductible is what you have to pay before the 80/20 takes effect. So you'll pay the first $283 of doctor bills, and then Medicare comes in paying 80% of everything above that, again with no maximum out of pocket. So those are the costs for Medicare, and worth noting that 202.90 as well as the two deductible amounts, those are adjusted upwards every year. It's like a cost of living adjustment. Medicare will announce at the end of the year what those numbers will be for the following year. So those numbers do get adjusted every year. The 80/20 is fixed. The no maximum out of pocket, that's fixed unless they change something down the road. So a $283 deductible is not too overwhelming. In fact, it's better than most group or individual health insurance plans I've ever seen. $1,700 per hospital visit, that can become a little more cumbersome. But the real red flag is the 20% with no max out of pocket. Of course, as we get older, the probability that we're going to run into health care expenses grows. And that's compounded by the fact that healthcare expenses have grown faster over the last 30 years than any other component of the economy. So you put those two together, and you have a real red flag out there for people that are moving into or are in the income fixed income phase of life. And that's John and Ballast's job is to protect and secure you for that phase of life. The last thing we want is some unforeseen giant medical bills being a wrecking ball to your retirement plans that you've worked all this time for. And the good news is, although I know it can be overwhelming on this side of it. Once we get through this, hopefully you'll see that it's not as scary, not as overwhelming. There's actually some really good options, very affordable solutions to plug these holes and give you that security moving on down the road. So that's what we're going to talk about now. What are those solutions? And I feel like when most people approach Medicare, there's so much noise and information out there. A lot of it really kind of intended to confuse people, because if you're confused, you're going to pick up the phone and call some marketing agency that's going to try to sell you some insurance plan. But ultimately, my goal here today is to simplify some of this stuff. And one of my ways of simplifying it is trying to take what looks like a million options and really boiling it down to two options. I often tell my clients, when we get to this point, we've kind of reached a fork in the road. It's really a left or right, A or B binary choice. I tell people, imagine we're in the forest, we've come to a fork in the road. And at this point, we have to choose left or right. So we're going to walk down these paths a little bit. Our first path on the left is marked with a plus sign. Because if we go down this path, we're going to add to Medicare. We're going to buy some additional insurance to plug these holes up. And this is what we call Medicare supplement or Medigap insurance. Those two terms mean the same thing. And when you receive any information from Medicare, they'll often send out when you turn 65, you get the Medicare and You booklet. Lots of great information in there, but there's one page that shows you all of the different supplement plans. These plans are named by letter, not to be confused with Medicare Part A and Part B, but this is Plan A and Plan B and C and so on and so forth, all the way currently up to Plan N. They've gotten rid of a few of them in between over the years. So currently there's 10 different plan options, and there's a huge grid of all the benefits and things that pieces and parts that each of those different plans pay for. And to be honest, it's probably the most overwhelming piece of information you'll look at when you get to this point. But the good news is we can trim that list down pretty significantly, because in the real world, most of the insurance companies, and by most, I mean the overwhelming majority of insurance companies that offer Medicare supplement coverage, only offer 3 of those options. And in all my travels, 17 years, thousands of people I've helped, I can probably count on one hand how many times I've run into somebody that has something besides Plan F, G, or N. Those 3 are 99% of the marketplace out there. So, and when it's something else, it's usually there's an extremely specialized reason why that was the case. So we're going to kind of focus our attention on Plan F, G, and N. Plan F is the Rolls Royce. Covers 100% of all of the costs we talked about. It covers the deductibles for A and B. It covers the 20% with no cap. Covers it all. It's great insurance. But Rolls Royces are kind of expensive. Also, Plan F has been semi-phased out. You can only enroll in a Plan F now if you started Medicare prior to January 1st, 2021, which we're 5 years past that. So don't see as many Fs these days, to be honest, and that's okay. One step down the ladder is the Plan G, which quite frankly, way before 2021, I felt made more sense for people. Plan G, one step down, so it's a little more affordable. With a Plan G, the only difference is you are responsible for that Medicare Part B deductible. Again, this year it's $283, and that resets every January. So you meet your deductible, and then it covers 100% of everything else the rest of the year.
That 1736 is not the insurance not subject to paying that's
no. All of these plans cover the $1,700 Part A deductible. Good question. This is
one thing I wanted to mention too, and not to interrupt you, for anyone that's on the call that has any questions as we're going through it, there is a Q&A and a chat at the bottom. Feel free to add those questions, and we'll answer those at the end. Go ahead, Richard. Sorry.
Yeah, absolutely. So yeah, G's premiums are a little lower for Plan G because you're taking on more of the cost responsibility. But when you run the numbers, honestly, you save more than the deductible that you're giving up. So for many years prior to 2021, I was telling people I think F makes a lot of sense. I think G makes a lot of sense. There's still room in there for the Plan N. In fact, I think there's more conversations about Plan N in the last year because of some rule changes. Plan N is still one more step down the ladder. With Plan N, just like the G, you are responsible for that $283 Medicare Part B deductible. And then there's a copay component where you'll pay a $20 copay for doctor visits and a $50 copay for emergency rooms. After that, it covers 100%. So the real question is, I'm sorry, let me jump back. I got ahead of myself there. 3 big bullet points about Medicare supplement coverage that I like to mention to everybody. Number 1, Medicare supplement plans have no network. You can see any doctor in the United States that accepts Medicare. I often will get people to say, well, my doctor has a sign up that they don't take this insurance or that insurance. That's totally fine and normal. But they are talking about some other kind of insurance. They might be talking about group, ACA, Medicaid, Advantage. They could be talking about a lot of different things, but they're not talking about Medicare supplement. And the reason I mention that, and we'll talk a little bit more about that in a second, is there are dozens of insurance companies that offer Medicare supplement coverage in Kentucky and in other states. And many of them will be names that you're familiar with. And there's a bunch that'll be names that you're not familiar with. And sometimes there's a reason to look at some of the smaller named companies that maybe people aren't as familiar with. And I'll get that quite well, is my doctor going to take this? Or I need to check with my doctor. You don't. If they take Medicare, they will take the insurance coverage. Another thing that helps people making these decisions is bullet point number 2. These plans are standardized, which is to say, a Plan G is a Plan G no matter which insurance company you get it from. A Plan F is a Plan F. These plans are built, and the framework is built by the government, and the insurance companies come in and say, here's what we can offer that insurance for. This is very unique in health insurance and in insurance in general. That is meant to help people not get confused. So some insurance company can't come in and say, oh, our plan in has all these extra features. No, plan in is plan in. It's got to be exactly the same as everybody else's. So no network. The plans are standardized. Last but not least, the rates do go up every year. So when you enroll in a Medicare supplement plan, those rates do go up every year. And that's a reason why we do look outside of just the big name carriers. We're appointed with all of those. We use those frequently, but we do like to see if there's anything else out there. We want to make sure we're not missing anything. And there are some competitive, smaller insurance companies who, people in the insurance industry would recognize the names, but maybe not the ordinary consumer. And that's okay. And the reason we look at them is because they're smaller. They can maybe be a little more nimble and flexible or strategic with their pricing. They may offer some spousal discounts. I've seen that happen. So there's reasons why we look around. One of the things I've used this analogy before, because these plans are standardized, we're very close to an apple to apple scenario. So why would we pay $3 for an apple if we can get the same apple for $2? The plans work the exact same way. There's no network. Really, the only issue we're running into here is, what about those rates going up? Yeah. So we want to try to steer away from companies that are known for big rate increases. So while we will look at some other carriers out there, we don't have a crystal ball. I can't see into the future and know who's going to have what kind of rate increases next year and beyond, but I can look backwards and see what kind of track record they have for rate increases. So we do try to stay abreast of that. And if there's a carrier out there that's got some competitive pricing and has a good track record with their rate increases, it's something we want to add to the stable of options. We talk about premium a lot. We don't have enough time to dive into all the nuances. I basically just at this point would say, for the purposes of this conversation, an average Medicare supplement plan is going to be run around $150 for a 65-year-old new to Medicare. But there's a lot of wiggle room there. As I mentioned before, F is the most expensive, G is a little less expensive, N a little less expensive than that. But age matters. The older you are, the more expensive the plan is going to be. Males are typically more expensive than females. Some companies offer spousal discounts. Some companies may even break it down regionally. Their research may say, well, look, it's more expensive to insure someone in, say, Eastern Kentucky than in Central Indiana. So the rates may look a little different that way as well. But for our purposes today, we can just kind of assume $150 is a starting point for this conversation for the Medicare supplement. Now, I mentioned before, Medicare supplements pay as long as Medicare pays, the Medicare supplement will pay. If the doctor takes Medicare, then the supplement will pay. And that's great. On the plus side, that means that it's going to cover anything that Medicare covers. The only time you're ever going to have a denial issue will not be because your Medicare supplement plan denied it. It will be because Medicare themselves denied it, which is exceedingly uncommon. Medicare is known for approving all sorts of stuff. So as long as Medicare approves that lab, that test, that procedure, that surgery, that stay, then the supplement plan will pay it, no question. There is no prior authorization, no pre-approval. That's wonderful. But on the other side of the coin, Medicare only covers hospital and medical. What about the things Medicare doesn't cover, like prescription drug coverage? Well, for that, we have to walk a little further down this path, and we're going to run into another plus sign. And this is where we talk about Part D coverage or prescription drug coverage. Prescription drug coverage is kind of a necessary component for just about anybody, even when people come to me and say, well, I don't take any medicines or my medicines are very inexpensive. I understand, but there is a late enrollment penalty if you don't take it when you're supposed to take it. And as we get older, and I have people all the time call, well, I never took it out. And here we are 10 years later, and now they're going to be saddled with a pretty significant late enrollment penalty. And the good news is the drug plans range in price, and there's some very, very inexpensive plans. In fact, in Kentucky, I believe there's a plan for $0 currently. So it's kind of keep you legal for less. That way you don't have to contend with late enrollment penalties later on down the road. Now, the average price for a Part D plan in Kentucky right now is about $40 a month, but they range widely. Part D coverage works like this. You pay your monthly premium. You're going to have a deductible in most cases. So you'll have to pay the first however much, few $100. Once you've met that deductible, then you'll have copays based on the tier of medicine that you're taking. Tier 1 and Tier 2 typically means most of your generic medications. Tier 3 and Tier 4, even sometimes there are Tier 5s. You don't see them too often, but Tiers 3 and above would be your brand name medications. One new rule that went into effect last year, part of the Inflation Reduction Act, there is now a maximum out of pocket for prescription drug coverage. Currently, it's $2,100. So if your out of pocket expenses reach $2,100, which is not common, it does happen. I have some clients that take specialized medicine. They hit the $2,100 in January. And at that point, your medication is zero copay the entire rest of the year, and then that resets in January.
One question real quick, Richard. Am I correct that in circumstances where someone has specific prescriptions that they're accustomed to taking, or even pharmacies that they are accustomed to using, that you have the ability to kind of find the Part D that matches up with their need?
Yeah, absolutely. So Part D is highly individualized. Depending on the medicines you take, the pharmacy you use, that's going to dictate what's the best plan for where you are right now. Now, the good news about Medicare Part D coverage is you can select a new plan every year during the annual enrollment period, October 15th through December 7th. Pick any plan you want. No health questions, doesn't matter what medications you're taking. You can pick whatever plan fits your needs for next year. And I do advise my clients to at least review that on an annual basis and make sure that the plan they're in is going to continue to be the right solution the next year. Your medicines may change, but the plans will change. They do adjust their premiums, their deductibles, their copays. They may change their formulary. A medicine that was covered this year, they may decide, well, we're not going to cover that medicine next year. Those are important things to know on the front end, rather than, we get into a new year, you show up at the pharmacy and they say, well, yeah, your medicine's not covered by that plan. So prescription coverage is certainly something we want to look at on an annual basis. Last but not least, as we walk down this path, come into another plus sign. And this would be a few more things that Medicare does not cover: vision, dental, perhaps hearing coverage. This is extra coverage down this path. Individual coverage, pretty self-explanatory. You want vision, dental, or hearing coverage. I'd say average price, you're probably looking at about $50 a month, depending on how much vision and dental coverage you want. But that's the picture on this, down this path. We're going to have Medicare operating as our primary health insurance. We're going to then supplement that with a Medigap or Medicare supplement plan and add in prescription coverage and then the vision and dental to complete the picture. And that's one path. But there's another path that is growing in popularity recently. Doesn't mean it's for everybody, but it has been getting a little more attention lately. And this path is not marked with a plus sign because we're not going to add to Medicare. In fact, we're going to replace it altogether. So this path is marked with an equals sign. This is what we call Medicare Advantage, sometimes referred to as Part C. In fact, I've heard it referred to as Medicare Replacement because that is how it functions. It replaces your Medicare. In this arrangement, the insurance company comes in and kind of acts as a subcontractor to Medicare. Medicare basically says, well, look, we're just going to pay you guys a set amount, and now that individual is your concern. And so the Medicare Advantage plan, if you choose that, becomes your primary insurance. The Medicare kind of goes into hibernation. And since they're taking over for Medicare, that means they are now your primary insurance for hospital and medical, but they're also probably going to include prescription coverage. They very well may have dental, vision, hearing aid coverage. Gym memberships through Silver Sneakers is very common. And then other bells and whistles that different plans may add. I've seen transportation benefits, over-the-counter allowances, health and wellness bucks, all sorts of different things that can kind of get added in there. And because they're getting paid by Medicare as acting as that subcontractor, very commonly you'll see these plans at zero premium. Now, there are some plans out there that may carry a small premium. In fact, there's even recently becoming more popular what they call Medicare Advantage give back plans, where they even give you back some of that $202 a month. But the vast majority of what we see out there these days is what we call a zero premium Medicare Advantage plan. And worth noting, I alluded to it, but I will make this point. With the Medicare Advantage plan, even though there's no premium, you are still paying the $202.90 Medicare Part B premium. That's kind of hard to get away from. That's going to happen either path you choose. So at this point, most people look at this equation and go, well, wait a second. You're telling me I can get all of this on one plan for zero, and then on the other side, I'm paying all this money. Why in the world would anybody choose the plus sign path? Well, there are some differences here. Number one, Medicare Advantage plans do work on a network framework. So either a PPO or an HMO network, there is going to be a list of doctors that they say, here's the doctors that accept our plan. You need to see these doctors. Now, in a lot of cases, that's not a huge limitation. Kind of depends regionally where I'm talking to people, if they travel a lot, if they have doctors out of state for whatever reason, that can present some limitations. But again, these plans have become quite popular in the last 5+ years. And so a lot of healthcare providers will take most, if not all, of the plans. So we don't run into a ton of network issues. It's just something that we, conversation at the beginning is, who are your doctors? Let's at least limit it to the plans that that work with your doctors. The rubber actually really meets the road on our second big difference, copays. Nothing in life is free. If you're not paying for the insurance, you're paying copays for the care that you receive. So while the Medicare supplement side of the equation is more of a pay it up front, hey, I'm paying this monthly premium whether I go to the doctor or not, and I know I'm covered. The Advantage plan works more on I'm not paying for the insurance. I just pay a copay when I go to the doctor or hospital or whatever it may be. The copays are pretty attractive. Obviously hospital stays are going to have higher copays than, a doctor visit and things like that. But every plan is going to have a summary of benefits that reads kind of like a restaurant menu, a whole list of everything you could do. And with it is attached a copay associated with it. The nice thing about Medicare Advantage plans, or one nice thing about them is, even though those copays are there, they are limited by a maximum out of pocket, unlike original Medicare that has no maximum out of pocket. These plans are required to have a maximum out of pocket. In Kentucky, and these plans range regionally. They'll look very different in one state from another. But in Kentucky, at least, maximum out of pockets range usually around $5,000 to $10,000, which is a big number. But it's a lot less than infinity, which is what you're left with original Medicare. And I would say the vast majority of people do not hit those max out of pockets. I have seen it. I've seen people hit it early in the year, depending on their health and situations that they're in. But it is not the common outcome. The third big difference with Medicare Advantage. So again, just to recap: network, copay, and then the third difference is prior authorization. Because we're shifting the primary insurance responsibility away from Medicare and to an insurance company, that now gives them the responsibility of deciding what they're going to cover and what they're going to approve and authorize. And so Medicare Advantage plans, Medicare does this too, and they can, and I have seen Medicare deny certain things, rarely. Medicare Advantage plans do that. Some of them are a little more aggressive with those prior authorizations, denials, and limitations than others. And so that's one of the things we try to guide our clients is to, and we work with a lot of healthcare providers across the community. So always trying to keep our ear to the ground as to which plans are more problematic when it comes to prior authorizations, denials, delays of coverage, and things like that, and certainly try to steer away from those plans. If there's good options elsewhere, why deal with that headache? So that's kind of our basic framework here. And I tell people all the time, like, look, we're not getting into the particulars here. That's more of a one-on-one conversation because the needs are so highly individualized. But as you approach Medicare and you start thinking about, well, what am I going to do? I tell my clients all the time, the best thing we can do is decide which path makes the most sense for you. Which one makes the most sense for your budget, for your risk tolerance, for your goals. If we can decide on which path feels most comfortable for you, then the choices that we make as we go down that path really fall into place very, very quickly and easily.
I've got two quick questions that came in, Richard. And I thought while we were on the slide, it'd be the best time to ask these. The first one was, when does the late enrollment charge go into effect for Part D? Is it a particular age or does it kick in at 65? What if you are covered by your spouse's insurance and don't need it at 65? Basically, can you be 70 and then sign up for Part D without a penalty?
Great question. And there's some nuances to this. The penalty does not take effect until you enroll in a drug plan. Okay, so if you have not had Part D coverage, when you enroll in Part D coverage, they'll go back and say, well, it's 1% of the average national cost for every month that you have not had coverage. So 1% per month. Unless you have had creditable coverage, which here's what will count: group coverage of your own or your spouse. What does not count is VA or retiree benefits. A couple of times I've had people go on their spouse's retiree plan, and then for some reason, maybe the spouse passes away or whatever can have that plan ends, something happens, and they have to go get a Part D plan. Ironically, and I don't know why they reached this decision, but retiree benefits do not count as creditable coverage as it pertains to that late enrollment penalty.
Oh, interesting. Yeah, that's good to know. But if someone's covered under their spouse's plan, as long as they had credible coverage when they
Yeah,
enroll in Part D,
absolutely.
shouldn't be a penalty. The other
No,
question that came in, this is a person that has Medicare Supplement G and a prescription plan, but did not take vision or dental. Is there any penalty for down the road adding vision or dental coverage?
absolutely not. That is that's kind of outside the framework of Medicare. That's just an individual thing. I would get it. John would get individual dental, they offer it to all ages. It just helps complete the picture. Again, Medicare doesn't cover any dental or vision. So if we're looking at completing the complete picture, I think vision and dental coverage is part of that conversation. But yeah, you can not only is there no late enrollment penalty, you can enroll anytime.
Oh, there's no open enrollment period on that. Technically, you could
Nope.
do that throughout the year. Okay, good to know. All right.
All right, moving on. So we're going to talk about something called IRMAA. I think this is probably pretty important for this audience here. IRMAA, income related monthly adjusted amounts. So I spoke earlier about the Part B penalty, this 202.90. I'm sorry, not penalty, premium. So Medicare Part B, again, just to recap, Medicare Part A is no cost. Medicare Part B, the standard premium is 202.90, $202.90 a month. They will take that straight out of Social Security. Unless you're not taking Social Security, and they'll bill you quarterly for that. That's the standard premium. The chart I'm showing you here basically explains the higher your income is based on these different levels. There's 6 different levels. They'll charge you more for the Medicare Part B. So we'll look at joint on here. If you're filing jointly, income's less than $218,000, the premium is the 202.90. But as we move up, that premium does start to go up. So the next level, 218 to $274,000 a year, your premium's 284. Above that, 405, moving up and up and up, all the way to the highest level, joint income over $750,000. Your Medicare Part B premium is over triple at $689 a month. And again, that's important to know. This catches a lot of people by surprise. They'll know everything I've talked about, and then they jump into Medicare and they get that first bill and go, "What in the world? This is much higher than I expected it to be." So this is an important piece, again, especially for this audience. I mentioned earlier, John, we were talking about this. They base your income on whatever you filed your taxes year before last. So if it were this year, they'd be looking at your 2024 tax returns because you would have filed those in 2025. So where I see this be an issue for people is if they've taken a really large distribution from their retirement plan, or maybe the sale of a business, the sale of some property, maybe they're downsizing their house or something like that. All of those things can trigger a big bump, all of a sudden, a big spike in their income that one year. And when Medicare or Social Security sees that, they're going to assess that penalty. And now, the next year when it goes back down, your premium would go back down. There is an appeals process. You can try to appeal that depending on the situation and scenario. There's a pretty easy form that says, "Hey, do one of these situations apply to you?" You can certainly try to appeal that process. It is very hit or miss how much that appeals process gets approved, but we've got that paperwork if that's something that has intersected
Yeah,
you.
I pulled up earlier preparing for this, what are deemed like the life-changing events that would allow an appeal. And it's work stoppage, change in marital status, loss of income, employer settlement, or incorrect data. I mean, most of the time, and this has become a planning dynamic that we have to, think through with clients, that big big appreciation on stock portfolio and making big changes to the portfolio can trigger excess income that flows through to IRMAA, and now all of a sudden they're paying 2-3x what they were paying previously. So it's a new part of the picture that has to be considered.
It does. It does. It gets forgotten all of the time. All right. Last but not least, let's see here. We'll go on to new rules and strategies. So a couple of bullet points here. Medicare supplement birthday rule. First thing I want to talk about. Medicare supplement plans, they have health questions. The application has health questions. They go through underwriting. They can and will turn people down. And so I tell my clients all the time, listen, when we get into Medicare supplement, when we're brand new, this is hopefully not the last time we're going to have a conversation about this, because as I mentioned earlier, those rates do go up. After about 5 to 7 years, we'll probably have bumped that rate up enough that it's worth having a conversation to see, is there something out there that can bring that rate back down? The answer after 5 to 7 years is commonly yes. Used to be yes, if you can pass the health questions. And sometimes people could not. And unfortunately, we had to tell them, there's really probably not much we can do. But that has changed in the state of Kentucky and several other states that have recently passed the birthday rule, which now says, regardless of your health, as long as you apply on your birthday and up to 60 days, the way it works in Kentucky, the window opens on your birthday and is open for 60 days. If you apply during that period, you can find a new plan. You have to switch plan to plan. So you have to go, if you're on a G, you have to switch to a G. Or if you're on an N, you have to switch to an N, F to F. But regardless of health questions, as long as you're doing it in that 60-day birthday window, you get new preferred guaranteed rates. And we've helped a lot of people over the past couple of years. I had a woman in here that was 91, 92 years old. She'd been on the same plan since 65. So even at a small rate increase, John, you know, compound interest, 30 years is a long time. So she was paying close to $500 a month for her supplement, which kind of blew my mind. That's on the upper end of what I would see. We cut her rate in half by using the birthday rule. She did have some health issues that would have, under the previous rules, she wouldn't have been able to do anything about it. But because of the birthday rule, we were able to cut her rate in half. I spent most of the conversation having to convince her it was the exact same coverage. She thought it was too good to be true. So that's the birthday rule. Next up, the Inflation Reduction Act I mentioned earlier that has added this maximum out of pocket to prescription Part D coverage. That's been a big help to some people, although the overall has kind of resulted in higher costs for prescription coverage. Plans have gotten a little more expensive, deductibles have gotten higher, copays have gotten higher as a way to kind of compensate for these regulations saying, well, hey, you insurance company, now you have to pay everything above that $2,100. Well, that cost gets shifted to the consumer. Similarly, Medicare supplement coverage, we've seen higher rate increases of late because of the birthday rule. If the government comes in and says, hey, now all those people you used to turn away, now you have to take them as long as they apply on that 60-day time frame, that's going to make everybody's rates go up. But again, we're 2 years into it in Kentucky, so I think we're starting to hopefully see those rates kind of level out. Next on our list, high deductible plan G. These have been around for a while. I've never seen one in the wild, but because of rates getting a little more expensive, costs going up, some conversations about Medicare expenses going up, like premiums and deductibles for just the basic Medicare. I am seeing some people talk about using a high deductible plan G. This is a plan G like we discussed before, but it has a much higher deductible, like a $3,000 deductible, which seems high, but the rate is much, much lower. So it can sometimes bring it into a more affordable zone for people. something to think about. I'm just seeing that being discussed in some strategies moving forward. Last but not least, hospital indemnity plans. With a high deductible plan G or a Medicare Advantage plan, hospital indemnity plans are kind of a secondary type of coverage that comes in and says, well, look, some of the big ticket items that would make you hit a high deductible on a high deductible plan G or a max out of pocket on an Advantage plan, something like a big hospital bill, cancer, outpatient surgery, those types of expenses. You can buy maybe a hospital indemnity plan that will reimburse you for those costs. You can kind of think of Aflac. People mention Aflac a lot for this type of stuff. It works like that. It's just something to kind of augment and provide a little more peace of mind to know, hey, I've got the little stuff covered and I've got the big stuff covered. Just different strategies for different people's needs. That's about it for my talking points today.
I've got some questions.
Good. Go
Some
for
more
it.
that have come in. So I had a question come in on international travel. So if you have someone who in their retirement years is planning on traveling and quite a bit overseas out of the US, is there a advantage to Medicare Advantage or the supplement, or are they somewhat equivalent in their ability to cover that type of need?
Advantage plan, that's a good question. I get this a lot. Advantage plans don't offer international coverage. Medicare supplement plans will state that there is some emergency coverage, but it's vague and spotty how it works. My advice is to look into travel coverage. It's not terribly expensive. Depending on what you need it for and length of stay, it can be actually very, very inexpensive and is going to work more what you're trying to accomplish than a Medicare supplement plan. If you go into the hospital in Barcelona and show them your Medicare supplement plan, you might as well show them a Keeneland race ticket. Like, it's not going to mean anything to them. So you're going to get a bill, and then you're going to be filing claims with your Medicare supplement company once you get home. And they're going to say, well, look, we're covering is emergency services. We're not covering to get you back to the United States. We're not covering anything outside of the emergent situation. So that's where travel insurance really can come in and give you that type of peace of mind. Like, okay, I know even if it's not necessarily emergency, but you know what? I don't really feel like having a sinus infection on my vacation, or gosh, worst case scenario, I've got to figure out how to get medevac back to the United States. Those things you're going to want travel insurance for. And again, it's very, very affordably priced.
Good to know. So you mentioned on the birthday rule. So let's just say I'm an 85-year-old and I'm on plan G and I want to, or plan N, let's say G in this case, but I want to switch to plan G. I want to go to a different one. I would be subject to underwriting to make a swap, but
Yes.
if the plan number changes, but if it's the same plan letter, I should say, I can move to another company utilizing that birthday rule with no health underwriting associated with it.
Correct.
And that is also the case for someone who would be on Medicare Advantage who then wanted to switch over to a supplement. They would be subject to underwriting.
Okay, so yes, some nuance here. The birthday rule only works for letter to letter Medicare supplement change. So you have to have a Medicare supplement and you have to then replace it with the exact same plan letter.
Mm-hmm.
Advantage plan is not a supplement. So birthday rule is not going to work there. If you're on an Advantage plan, and this is an important nuance that I kind of skipped over here, but worth revisiting with this question. As you embark on this journey and you make your first decision, please know it is easier to go from Medicare supplement to Advantage plan than it is to go from Advantage plan to supplement, for exactly the reason you're mentioning. If you start with an Advantage plan, maybe somebody's thinking is, man, I'm healthy as a horse. I'm going to go with the Advantage plan, save my money, And then 6 or 7 years down the road, if my health deteriorates, then I'll switch over to a supplement. That's not going to work. There's going to be underwriting health questions and they will turn you down. And it does not matter when your birthday is and when it's not, you will the door will kind of be closed then. Then it's basically left up to making, what's the best Medicare Advantage option for me. The other way, if you start with a Medicare supplement plan and 4 or 5 years into it, you say, we're spending a lot of money on this insurance and we're not using it as much as we thought. And my neighbor or my sister or my friend has an Advantage plan and just thinks it's the cat's meow. That's an easy choice. You can switch over to the Advantage plan during the annual enrollment period, no questions asked. January 1, you'll be on the Advantage plan. But just know that going back to supplement, there's going to be health questions.
Great. A question we get all the time, and this is a normal scenario. I'm getting ready to turn 65. When do I need to start?
My favorite question. 3 months, 3 months ahead of your retirement date, to keep it simple. I have people that are very antsy about it. And I'm like, well, yeah, we can meet before and kind of go through some of this stuff and at least get your mind thinking about which path you're going to be most comfortable with. We can dial in some specific costs, maybe even look at, your specific list of prescriptions or doctors or whatever, and really kind of fine tune it. But there's not a lot we can do until 3 months before you intend to start your Medicare. So, hey, I'm 68. I'm still working. I'm going to retire at the end of the year. Okay, well then let's plan to talk in September, October. Because if we send any paperwork into Medicare to say, hey, I'm ready to start my Medicare at the end of the year when I retire, if it's more than 90 days before that start date, they're going to send it back and say, try again. So within 90 days, and that gives us plenty of time. Medicare, Social Security works very, very slowly. So 90 days is a good time. We can't do much before 90 days, but we don't want to wait until 2 weeks before we retire either, because it takes Social Security about 4 to 6 weeks from when you get your paperwork into them to then get you your new Medicare card.
Yeah. One situation that we run into fairly often is someone who is over 65, still working, still on their employer coverage, but then at age 67 or 69 or 70, while still working, decide to opt for taking Social Security. Am I correct that enrollment into Social Security, it kind of automatically signs them up for Part A, but they don't have to opt for Part B until they need coverage?
No. If so, you can draw Social Security as early as 62,
Correct.
or if you're on disability. We're not going to get into disability, but if you're drawing Social Security prior to your 65th birthday, when you turn 65, they just assume you want Medicare and they send you a card for A and B. If you are not drawing Social Security on your 65th birthday, you will have to initiate the enrollment into Medicare also, even when you do the Social Security piece of it.
Yeah.
Or if you want to delay Social Security but decide, well, I'll go ahead and sign up for Part A. It's free. You will have to let Social Security know that I do want the A, not the B, not the Social Security, but give me
Yeah.
the free stuff, and we'll delay the other
Yeah,
stuff.
I've run into that for sure. So, um, yeah, I mean, I think Richard, this has been great. And I think what I've found in having these conversations, referring clients to you, is every situation is so nuanced. So, and it's to do with their financial picture, their income, to your point, their level of conservatism, risk taking. As I see it from my seat, the supplement eliminates a lot of questions, right? I mean, you kind of have a certainty around your monthly cost. you might be overpaying in certain years of what you would have otherwise been paying if you had gone the Advantage route, but there's a certainty and a kind of an established understanding of what your out-of-pocket cost is going to be,
Absolutely.
largely. Whereas with the Advantage, in years where there's not a lot of health need, it could be very low cost, but in years where you have significant need, it could be considerably more expensive than had you gone with the supplement. So I think that's why I would just, for anyone listening now live or when we post this on our site and the recording of it, I just think whether it's Richard or someone like Richard, I just would advise you to, you're going to get a lot of solicitations in the mail. You're going to see a ton of TV commercials on this with celebrities telling you what plan that you need to take. I think having an expert that can kind of walk you down the path like he did with us through this presentation and find out what's suitable to you. And then I don't think it just ends there. I think it's also someone that can like we approach financial planning. It's really never done. You always have to come back and readdress the idea of what's appropriate level of coverage, what, and as you know, Richard, I mean, in your 17 years, how many changes have you seen? I mean, it's constantly evolving. So he posted, you want to put your contact information back up on the screen one more time, just in case anyone wants to reach out to you directly. I'm glad we're doing this now because I know when I called you in November related to a client, you were, I think, booked solid for about 4 weeks. So
Yeah.
I think we caught you at a good window in the year.
Yeah, it gets busy October through December, but we make it work.
I had a question just come in and said, can you stop the robot callers from Medicare Advantage from calling me? I guess they're blowing people up.
They do blow people up, and it is a talking point. I've tried to express my opinions on this at various compliance meetings and so forth. It's awful. And if it's not Medicare, it's something else. I get calls about being approved for X, Y, or Z 15 times a day, and I block, and it seems to do nothing.
Yeah. Well,
Um,
I really appreciate you joining us today. This is great information. I know you answered a lot of questions. I've already had some thank you messages come through. So clearly people are enjoying this presentation. And I would just encourage you to call us if you have any questions about the presentation. Reach out to Richard directly. He's been a gem to work with our clients over the last number of years. And so we're not affiliated. We have no financial incentives, but just other than just making sure our clients are being taken care of, and he's consistently done that.
John, I appreciate you having me, man. Really, I enjoy sharing this stuff. I like trying. I know, I've worked with this population for a long time, and I see the stress and the anxiety it causes. And quite frankly, I try to put myself in people's shoes and think about, man, these people have worked hard and put together they want to enjoy their retirement. The last thing I want to be worrying about in my retirement is insurance stuff. So yeah, if it's not me, find somebody you trust that seems to kind of have a grip on this thing and maybe specializes in it. That's one of the decisions we made early on, was we don't want to be a jack of all trades. Yes, I can try to simplify this stuff, but there are a lot of nuances and angles and little kind of hidden strategies that we can kind of employ to help people, and we do. So you want somebody that knows what they're doing and is going to help you guys enjoy your retirement instead of stressing about all of these changes.
Yeah, and you're carrier agnostic, correct? I mean, you have any and all carriers available at your disposal. You can go out and find the plan that's best for the client.
Absolutely.
All right. Well, thanks again. Really appreciate it. Thank you all for attending today. We will post this to the website. And if you have any feedback related to this webinar or any questions specific for us, we're happy to answer. And if it's too hard a question, I'm sure my first call will be to Richard to answer it for me. Thank you all.
Thanks.